Good morning. My name is Gary Cox, State Commissioner of Health, and so we're happy to have all of you here today. And so behind us you see several of our public health partners in the community, and thank you all for coming today. We appreciate that, and we'll be working with them in days to come as well. We also have Dr. Doug Dravet and Lawrence Burnson, who's our state epidemiologist. Dr. Dravet is an OU infectious disease expert, and both of them will be here to answer questions, and we'll have a question and answer at the end of our short presentation here. We'd like to really cover three things with you here today. One is our current situation, where we are now currently. Secondly, what is public health doing in Oklahoma to respond to this situation? And thirdly, what can the public do to protect themselves? And so I think, as most of you know, the coronavirus is a novel virus. It's a new virus, started in China. It is a very serious epidemic in China. It's rapidly evolving and changing every day. As far as the risk factors for Oklahomans, it is a low risk for any single individual currently in Oklahoma, and we don't want Oklahomans to be fearful, but we are taking it seriously in public health. And in public health, of course, preparation is the key, and so that's what we'll be focusing on as we go forward. So our current situation, first of all, in China, as many of you know, over 6,100 confirmed cases, over 130 deaths. We know this is rapidly changing day by day. In the United States, to date, 5 confirmed cases in 4 states. In Oklahoma, we have 2 persons under investigation currently. Both of the samples from these 2 individuals has been forwarded to CDC in Atlanta, and we're awaiting results on those two laboratory results. We expect to have those sometime in the next 24 to 36 hours, and when we do get that information, we will be sharing it with the media. Now, what are we doing in public health to address the situation? First of all, we've issued several advisories statewide to healthcare providers, more or less giving updates as to what our situation is. We have an epidemiologist on call 24 hours a day, 7 days a week, and they are fielding calls from health providers and from others. As we mentioned, we are monitoring the 2 individuals under investigation currently, and one important thing that we'd like to do going forward is to form a multi-agency coordination and planning team. And so many of these partners that you see behind you, we would hope would be on that team. And basically what we want to do is, this is planning and thinking through scenarios and situations should we have an outbreak here in Oklahoma. Of course, we always want to plan for an event like that, and of course, we want to we hope that it never happens here in Oklahoma. But preparation is the key, planning is the key, and we want to get a broad group of stakeholders together to think through different situations and scenarios that may or may not come our way, and hopefully not. Now, what can the public do to protect themselves? I'd say, first of all, if you're planning to travel to China, there is a travel advisory out for unnecessary travel, so you might want to rethink those plans in light of the advisories. If you've returned from China, certainly watch for symptoms, and our folks are available to take those calls about concerns in that area. And also, just the common protections that we talk about in public health daily, whether it's the flu or a cold or whether it's coronavirus or what have you. Wash your hands, avoid close contact with persons who are ill, stay home if you are sick, things of this nature. And on a separate note, It has really nothing to do with the coronavirus, but we're still in the midst of a heavy flu season, and so it's not too late to get a flu shot, and we certainly do advise that. So now we've covered just kind of an overview of our situation. We'd like to open up with our experts if you have questions that you may want to ask.
So what criteria did those patients that you are testing have to meet for you to know you needed to test them?
Okay. Yeah, Lawrence?
Sure. Good morning. So for the novel coronavirus response, there is a national persons under investigation criteria that all states are using. And that includes right now symptoms specific to fever and cough or shortness of breath and history of travel specific to Wuhan, China, or if you were in contact with a confirmed case. So in order for us to initiate an investigation, which would involve collecting specimens for testing, an individual would have to meet that criteria. So just a quick point, the process is that if a healthcare provider has a person that they suspect might be a concern because of those symptoms and their history of travel, they can contact our epidemiologist on call system. We quickly go through that initial consultation, gather the information necessary, and then initiate specimen collection if they do meet that criteria. And for the state, both individuals met the criteria to initiate the specimen collection. So when it comes to the investigation, one thing to really stress is that the investigation's already started when a person is even under investigation initially. If you meet the symptom and travel history criteria, we work with the healthcare providers and with the individual specifically to assure that they are going to isolate themselves. If they can manage their symptoms at home with just personal care, then they're going to be isolated at home and we'll be in daily contact with those individuals while they're isolated with pending test results. We also initiate the interview process where we identify close personal contacts that are at risk of exposure. And those individuals we reach out to preliminarily to assess whether or not any of them have any symptoms of illness in case we need to broaden our scope of testing, as well as stay in touch with them daily to make sure that we know whether or not they develop symptoms during the process. And if a person is confirmed, the process essentially just continues on, meaning that those individuals will be monitored for 14 days from their last date of exposure when the individual that was confirmed was infectious. That means daily contact with a public health official, notifying us immediately if they develop symptoms, even if that's after hours, and then we'll arrange if we need to transition to having an evaluation, specimen collection, and further isolation of any contacts that develop symptoms. And that's really core public health practice that we put in place, something that we do for other diseases like measles, tuberculosis, pertussis. It's something that is standard when it comes to these investigations.
So can you say if these two patients are in Oklahoma City, can you tell where they are in the state, which of these two persons?
Good question. We always have to balance the confidentiality requirements and the needs for individuals that want to maintain their confidentiality and the information that we need to provide to the public. So we're not releasing information in regards to where in the state they are at this time. We are discreetly working with the individuals that are identified as close personal contacts because individuals also, even if they're known as a contact, would like to maintain their own confidentiality. If there is a need to notify the general public about a potential risk in a public setting, then that would be a situation where we would put out more details in regards to public places a person might have frequented, the specific times of day and dates that they were there, and what symptoms to look out for if we're trying to reach people that we could not actually get a hold of. To assure confidentiality, if we can identify all individuals that were exposed in a certain setting, such as a public gathering or even a private gathering, then we do not release that information if we can notify all individuals and know that we've reached them. If it's something broader where it's uncertain that we've actually identified all people, that is a time where we may have to put out a specific advisory to the public to be on the lookout for potential symptoms.
So these two patients are quarantined to their home at this moment, correct?
Specifically isolated.
Isolated.
Yes, so isolation is when you're symptomatic. So individuals, even under investigation, would be isolated during the time that they could potentially be infectious to others, even during pending of test results. If the test results are negative, then that may reflect to considering of other possible causes of illness, and if there's still a time frame where they need to remain away from public spaces, especially if they're currently symptomatic. Yes.
Were they traveling together, these two people, or are these two people that came in?
Two unrelated individuals.
And if they flew in, like, on an airplane, obviously, because they came in from China, into Oklahoma City or whatever, do you notify everybody that was on that plane, or what happens there?
So that also depends on the timing of the onset of symptoms and when they might have actually traveled. What we know is that a person is most likely infectious, or their greater level of infectiousness to others is going to be during the time that they actually start symptoms of illness, and then a period of time after that. So if an individual is actually traveling and symptomatic, then there is a process in place with public health authorities where we can communicate with our federal partners to identify other individuals that were on the same flight. And then we work with our state partners across the U.S. to notify other states of the residents of their state that might have been on the same flight for follow-up and the same type of investigation and monitoring if that's needed. In this situation, that's not a part of the process that's required.
What's their condition right now? Is it just minor flu-like symptoms, or how are they right now?
Well, we'll say that the individuals did not require hospitalization. Wouldn't want to provide more details in regards to like the status, but we'll say that they did not progress to a severe course of illness that required hospitalization.
Did they go to Wuhan? Is that where they went? Or?
They had the travel history that was required as a component for a person under investigation. Yes, sir.
Does that mean they've gone like past year or past week, or like what is the criteria?
The criteria specifically, if you actually traveled into Wuhan, China, within 2 weeks of your symptom onset. So the individuals would have had to travel during that time frame and then developed their symptoms within 2 weeks after leaving.
You said this is flu season. I'm just curious this process. Everyone who gets the flu, do you ask them, have you been to China? Is that how that
Good question. And I might want to refer to Dr. Dravet's.
Like thousands of people
yeah.
are asking if you've been to China.
I wouldn't want to capitalize on the. Have you have an answer? I don't see Dr. Dravet here. Or? Okay.
Was
So
that something that you guys are asking everyone?
I'll give you a quick response, and would want to defer to clinicians here. When it comes to the investigation process, we certainly, in the advisement to physicians, we did remind everybody that, and of course clinicians are going to be aware that there is, seasonal trends in other viral respiratory pathogens that are circulating. That would include the flu. So during an evaluation, a clinician would likely consider testing an individual for other likely etiologies, such as influenza, respiratory syncytial virus, and so that could be used to at least rule in or rule out other possible etiologies. That does not necessarily mean that it's part of the criteria for testing an individual, because there is a possibility for co-infections, meaning that a person might be experiencing illness that could be due to flu and yet still be infected with another pathogen. So that is something that is considered in our investigation. And I'll see if Dr. Dravet wants to kind of add anything on the clinical criteria there for like flu versus coronavirus.
Hello, I'm Doug Dravet. I'm the Chief of Adult Infectious Diseases at University of Oklahoma Health Sciences Center. And by way of disclaimer, I have never seen nor treated a patient with novel coronavirus. So all that I know is what I've read. So in general, the symptoms are roughly similar between coronavirus, at least this year's coronavirus, and influenza. Nonspecific fever, chills, body aches are present in most everybody with a dry cough. And then it can progress to more severe symptoms such as shortness of breath and pneumonia, and then a drop in oxygen in the body, and then other organ systems can be involved. So is there further information that was asked?
I was just curious how you guys are screening people. If you're asking everyone if they've been to China, if they come in with flu-like symptoms, or just monitoring it. If it gets worse, you're asking people to give them a call and let them know, or.
So folks, when they present into the hospital, are asked if they've traveled and if they have the exposure that Lawrence just talked about. And so then at that point, then that triggers a variety of downstream interventions, you might say. And for now, all the testing for the novel coronavirus is indeed at the Centers for Disease Control. I have read that they are hoping to push that testing out into the community, but that hasn't happened as of today. But Lawrence may know more about that than I do.
If these tests that you're sending to Atlanta are positive, what happens next? I think you kind of mentioned that. You can say that again.
So it's on a case-by-case basis. Not everybody who gets infected will develop severe symptoms. And so it's going to be a case-by-case basis as to how they are dealt with. And as of right now, there is no specific treatment for the novel coronavirus. There are some experimental treatments that are being tried in China. And we will presumably have information about those very rapidly, but we don't have any specific treatment there. So it's what we call supportive care. So respiratory support, ventilatory support if needed, and that.
These two cases, you guys have already identified everyone that they've come in contact with, is that right? Do you think maybe, yeah?
Yes, correct. That starts immediately. Again, it's part of the standard public health investigation, which is as soon as we even suspect, based on a person meeting criteria, in this case, it's called person under investigation. If they meet the criteria for us to go ahead and initiate the specimen collection and testing, then we're not going to wait. We're going to start the preliminary part of the investigation, which is interview the individual to gather an extensive history of exactly where they've been during the time of concern, which is from symptom onset to the current time. And then we identify all individuals. That would be household members, other close personal contacts like close acquaintances. They might have spent several hours or extended periods of time in closed spaces like in a car, traveling, in their home, at dinners and other parties and gatherings, in other general public places. And then we essentially look at the severity or risk based on the amount of time that a person would have spent in close proximity. We're talking about with novel coronavirus, what we're seeing is that it is what's called droplet spread, meaning that essentially within several feet of a person that is infectious, a confirmed case, from coughing, sneezing, laughing, and talking, they may expel droplets of the virus, and then those in close proximity. Granted, there have been more than 6,000 cases in mainland China. When you look at other countries, the number of cases has been fairly limited. And what we're seeing even in other provinces of China, not necessarily Wuhan, China, but other areas, the number of secondary cases, meaning people that were infected by another person, is fairly limited and has been primarily around household members, other close contacts, and healthcare workers that essentially, have a higher risk in general because of the care that they're providing for an individual if they require to be hospitalized and need that supportive care.
So this person, or one of these people, like, went to the grocery store, and then, like, were kind of feeling sick, went to the grocery store. I mean, are those, anybody else who went to the store, are they at risk, or what's the?
Not necessarily. When we're talking about droplet spread, that is definitely different from measles. We had a measles case last year, so you might be kind of thinking about that for comparison. Measles is airborne. It's one that if you're just in a room and you're talking, we're expelling the virus. And that is going to linger for several hours in the environment with measles again. And so it is different in the fact that we may have to identify all people that were in a public setting like a grocery store. With something like novel coronavirus, what we're seeing here is that really it's limited to closer contacts, more extensive amount of time in person with individuals. And so just walking through a general public space would not necessarily put a person at a higher risk. It's going to be more closer, prolonged contact. And those are individuals that we're identifying have reached out to initiate that daily contact and monitoring with those people.
What isolation looks like if a person is at home and they're with their loved ones. Are they just paint a picture for me, are they in a room by themselves? How are they able to eat? Are they able to talk to their family? What does that look like?
So there are home care guidelines that are available for reference in these situations. Novel coronavirus, we have some points of reference with other emerging pathogens like MERS coronavirus back in 2010 or SARS coronavirus in 2002 and 2003 and Ebola. With something like this for home care, it would essentially mean that the individual preferably would be living alone. That would be the best case scenario, where they can isolate themselves at home and that there is supportive resources for food, medications that can be arranged. And that might involve public health officials making those arrangements and working with them for those social service needs. And then if there are other people in the household, it may be that the person is isolated in their own room that's dedicated to them. They have their own bathroom that they're using, and that there's regular disinfection of those surfaces. So that way you have a dedicated space for the individual during isolation, and that they are separated physically from other individuals of the household. If they're going to be interacting with them, they kind of try to keep their distance. For a person who's actually sick, it may involve them having surgical masks that are provided, so that way they can wear them if they need to be transported, for example, by a loved one back to a facility for further care. That way you try to contain at least the germs that a person may be excelling during the time that they need to be in close proximity to somebody. But really it is kind of removing yourself from others, trying to dedicate a space in the household, and limiting your contact as much as possible with other individuals in the household.
I want to ask, we're talking about outbreaks, and I want you to describe how Oklahoma is prepared for an outbreak that would happen.
Sure. And I'll also open up for others. So, again, there's a framework here that really is kind of tried and true when we're talking about infectious disease response. Really, we're talking about detection, investigation, and control. Detection means that we're working with healthcare providers so they know what to look for and they report cases immediately to us. So we can identify them, we can start our investigation, test them to confirm it or rule it out, and then start our investigation, which means that we are interviewing the individual to identify other exposed contacts and then putting them under monitoring. If it's a very high-risk situation, it also might mean that it's not only daily monitoring for symptoms, but possibly even putting in restrictions for movement or excluding them from work, which would be kind of your quarantine situation where you're removing people from public if the situation requires it. Some situations you don't have to really restrict movement, but you stay in touch with individuals if it's a lower risk situation. As you're seeing with China right now, they have travel restrictions. They're canceling flights and ground transportation. Those would be similar measures if needed if we really had to control movement. We are working with our federal partners on the controlled movement aspect of this. What you're seeing is that you're having flights from China that are being essentially diverted to specific airports so individuals can be screened upon arrival for any symptoms of illness. And those individuals will be pulled out for further evaluation if they had a fever or other symptoms. That's part of the process, is to identify people quickly during their travel process. So that's the federal response is actually part of our response here. And then, of course, as referenced, we reach out and work with key partners to ensure that the right guidance is shared with everybody, whether it be recommendations for healthcare providers, what are the recommendations for infection control and environmental disinfection, what are the recommendations for EMS transport, what are the recommendations for schools and universities. All those are guidances that we develop as an event like this begins to escalate.
And you guys have like a plan in place for like a mobilization for like mass treatment, correct?
That is that's part of an incident command structure. So if there's a formal activation of incident command, then that may be part of it, which is mass care, and even if there's a need to consider like mass monitoring of individuals. So that is part of our emergency response plan, which involves other agencies that may have authorities when it comes to cancellation of public events, restriction of movement of individuals. All that is part of the process. Yes, sir.
Are you aware of more Oklahomans that are currently in Wuhan right now that are trying to make their way back to the state? And how does that look with your communication with federal agencies?
We have not heard if there are specifically Oklahoma residents that are currently in Wuhan that are trying to come back to the United States. So I'm not aware. That may be another agency that has part of that communication if somebody's in an official capacity. For example, there are some government officials that were recently essentially transported out of Wuhan, China, back to the U.S. By our federal partners because of their federal capacity. But as far as Oklahoma, we have not heard of specific individuals. I want to stress that we're not actively monitoring individuals as they come back from China. That was something that might have played out in Ebola, where there was a process in place where any individual that was in one of the outbreak-affected states for Ebola in Western Africa, we were notified upon their travel itinerary demonstrating they were coming back to Oklahoma, and we would start monitoring them as soon as they came back here for the 21 days. It's more passive in this situation at this time, although got to stress that if there's a need, that is a practice that could be put into place if needed in coordination with our federal partners when it comes to actively monitoring individuals upon their return, but it's not in place at this time.
So I think you touched on this. How does somebody get better from this then? I think you mentioned there might not be an exact cure. Is there a way that somebody, you just wait it out? What's the best procedure if they are tested positive?
You want to mention what Dr. Davis?
Well, thankfully, humans have been able to survive for millennia without any kind of antibiotics. Remember, the antibiotic era didn't start, we're not even 100 years into the antibiotic era. We're less than 50 years into the antiviral era. So the way people get better is through your own immune system and what we call natural host defenses. So you get infected by, in this case, you get infected by a virus. Ultimately, what you're doing is you're trying to develop an antibody by yourself and then a committed T cell probably that then fight the infection. Before that happens, and that process takes around a week to 10 days, before that happens, you have a variety of other cells in your body and other mechanisms that are there to try to tamp down the infection as it happens. And of course, that's more or less effective depending upon the infection. So.
All right, if there's no further questions, thank you for coming. And we'll be available for more information as we have further developments.